Since I've learned about KAATSU, my main thing has been trying to figure out what the physiology and what the effect is and this stuff. And I think that looking at it, I think this is a therapy that's very, very effective. I think it needs to be promoted. And I've got some patients in mind that, right now, the big thing is, I think, the treatment of diabetes and type 2 diabetes and treatment of hypertension. And this is part of the whole, metabolic syndrome that I deal with in my patient population. Yeah, the issue of type 2 diabetes is a very important one because it's largely related to inflammation. Because inflammation increases cortisol levels, and it's the cortisol levels that raise your target blood sugars, and your body is also producing insulin resistance. I test all my patients for insulin resistance, and most doctors don't even consider insulin resistance at all. They treat diabetes, but not insulin resistance. And so I'm looking at things that are going to reduce insulin resistance. This is a product that's going to reduce insulin resistance. And that's the study that needs to be done, by the way. They need to look at what's called the HOMA-IR. The HOMA-IR has been correlated to almost every disease process we're dealing with. In other words, a large HOMA-IR means that you have lots of insulin relative to your glucose. Many people are walking around with high insulin levels, but normal glucose. They're not considered diabetic, but the high insulin level, number one, insulin levels are related to cancer development. So they are a promoter of cancer. The higher HOMA-IR, the more likely you are to get cancer. They're also related to cardiovascular stroke risk. They're related to the hyperlipidemia and these other things. And what I've found in my men is that it's high estrogen levels that cause a high HOMA-IR. When I treat the estrogen and bring it down, so too the HOMA-IR drops. And in reality, it increases their lifespan and reduces their cardiovascular stroke risk and these other metabolic effects. Right. And the HOMA-IR is basically the product of your fasting glucose times your fasting insulin divided by, I think the factor is 18. And if that number is less than 1, you're okay. But if it's greater than 3, you have significant insulin resistance. And what I've noticed with COVID, by the way, my patients with COVID, not just my patients with COVID, all of our HOMA-IRs have gone up substantially post-COVID. And this is a very bad sign. It's a very bad sign for our health. And I believe, I don't know, there's some reasons for that. I just think that part of what we do to get back to normal, we have to get HOMA-IR down. There's lots of research on HOMA-IR. It's a very well-defined metric, and your device will do that. The reason why I know that is it reduces your hemoglobin A1C. If it reduces your hemoglobin A1C, it's going to reduce your HOMA-IR. All of the inflammatory markers, which cause an increase in the HOMA-IR also. And so it's possible that insulin could be an acute phase reactant, just like all other things. But I think in reality, what's happening is there is a set point that when you're under stress, the response of your body is to eat and to maintain high blood sugars. In other words, that's part of the stress response. Part of the stress response is to increase your blood sugars. And so it does that by reducing the sensitivity of insulin. Think about it.
Wow.
So insulin, diabetes is not just about insulin, it's insulin relative to the resistance. If you look at type 2 diabetes, it's not a problem not producing insulin, it's a problem of, in fact, all of the insulin levels on type 2 diabetics are elevated. They all have really sky-high insulin levels. They're all insulin insensitive. That's the problem. We have to focus on insulin insensitivity. it contributes to obesity, and it contributes to cardiovascular stroke risk and all that stuff. And so that's why when I look at KAATSU, I'm thinking this is a product that's going to reduce insulin resistance, and that has substantial health benefits in and of itself. But anyhow, Steve, that's my thoughts on KAATSU and where I see it fitting in my practice, because I see some patients who aren't really responsive to standard hypertensive and diabetic therapy. In fact, I think in general the way we treat hypertension is terrible, and it's, if you take a look at the metabolic syndrome, yes, diet and exercise is the way we should be treating type 2 diabetes and hypertension. However, doctors have realized that most people don't exercise, and so therefore there's nothing they can do. Well, KAATSU is an intervention they can do even when the person doesn't exercise, I believe. So it needs to be put in that context. I have to go because I got to get my patient out of the chamber.
I was just going to say thank everybody for hanging on and continuing the conversation.
Thanks, everyone. Appreciate everybody participating. I know it went a little long, but thank you.
Thank you.